syndrome. I would like to thank you all for your time ahead of time because this might run a little long, but I promise it'll be worth your time. So today on our itinerary, we'll be covering CRPS and generally what it is. We'll be covering some symptoms. I'll be covering the research that we have, diagnostics, treatment, and overall conclusions. So what is CRPS? CRPS, otherwise known as complex regional pain syndrome, according to the National Institute of Neurological Disorders and Stroke, CRPS is a broad term used to describe prolonged and excessive pain and inflammation that can occur following an injury or other medical event. And this is a picture of someone who has CRPS in their foot. So what we know is that it's a neuropathic pain disorder. It's characterized by allodynia, hyperalgesia, pseudo and vasomotor abnormalities, and trophic changes according to the NCBI. It is disproportionate to the initial injury. Pain is agonizing, chronic, and barely tolerable, according to a testimony from my mom. It is extremely rare in the US. CRPS developed in 4.56 people out of 100,000 a year, and treatment is experimental / non-existent. The most common long-term treatment for CRPS are ketamine infusions. However, there is no definitive treatment overall. I've heard for some temporary treatments, you can get cortisol / steroid shots in the afflicted area. There's sometimes nerve blocks, and my mom actually had a spinal stimulator surgery, but overall those were not very effective in the case of CRPS. So here's the pathology. Multiple mechanisms are known to be involved. It affects both the peripheral nervous system and the central nervous system. There's inflammatory factors with an increased overall fluid levels of pro-inflammatory cytokines, where there's also a decreased level of anti-inflammatory cytokines. There's a suspected genetic factor. We've been finding some associations between CRPS and human leukocyte antigen-related alleles. And there's also a psychological factor where heightened emotions have a greater impact on pain intensity for CRPS patients than for non-CRPS patients. So here's a statement from somebody with CRPS. Here's my mom. I'm going to keep it really brief, but she summarized her medical event that kind of triggered her CRPS was an ulnar nerve transposition surgery. It was initially performed to repair a small trigger finger and some numbness in some digits. However, she has lost almost everything but her sanity after her CRPS is diagnosed. She was at a level of pain that was highly complex and difficult to manage. And she said that she can't breathe, her chest feels tight, and she has an inability to move. It felt like my arm had been sawed off. Nothing has touched that pain. And here are some post-surgery images of that ulnar nerve transposition, including an x-ray. So here are some symptoms. So there are observed changes in nail and hair growth. Both my mom's CRPS has since spread to her leg as well. So you'll notice that the nail beds are very thin and that there's almost a plated appearance. On her toes specifically, there have been nails that fall off. And her fingernails are very brittle. There's changes in skin texture, notably that the skin will be very thin and loose. You can notice on her right arm that the veins are far more visible and that the skin appears to be looser. There's changes in skin color. These are one of the main traits that can really distinguish CRPS from other pain and inflammatory disorders. It can vary from being bright red, and you can see that edema in that first foot image, or it can be super cold and blue or black. There's also been observed blotchy red spots and things like that, but most commonly it's an entirely different color limb. There's a continuous burning or throbbing pain. My mom says she can't even touch her skin. It feels like it's on fire. And this is a very common sentiment that's been shared among a lot of CRPS patients. There's a hypersensitivity to touch and cold. There's that swelling and that edema shown in the affected area. And from there, I'm going to cover what we know about the disorder and any theories. So unfortunately, we have no idea what the direct cause is for CRPS. And I want to emphasize that hugely. There is very little medical research on it. It is practically unknown. All that we really know is that there has to be an initial incident that is believed to offset the inflammatory response between the central nervous system and the peripheral nervous system. According to the Mayo Clinic, though, we don't know much past this. There have been some articles and some recent updates that have been published regarding CRPS, but as a whole, a lot of those are speculative. There's also that possible genetic factor that I had mentioned previously, where there's been associations between CRPS and many major histocompatibility complex alleles, according to the NHI. But overall, research and knowledge is incredibly scarce. So how is this disorder diagnosed? Well, there is also no diagnostic test. However, there's a few general tests that can be used to eliminate the possibility of other pain disorders, such as bone scans that determine bone changes and any potential bone loss. There are sweat production tests that detect uneven sweating patterns, proving different temperatures. And those differing temperatures is why we get that different color in each limb. So there's x-rays that show potential mineral loss in bones. There's MRI scans which run tissue tests that'll help rule out other potential conditions. There's those trophic changes that report changes in movement, strength, range, and tremors, and sensory symptoms, which is an increased reaction to fine sensory stimuli that can help with diagnostics. So I know in the case of my mom, her range of movement in both her right arm and her right leg are very, very limited. She can barely rotate it. It's also very weak. She gets what she calls the dropsies, where she can't really hold anything because her fingers and those tremors will just completely give out. So what known treatment is there? And as I had previously mentioned, there's a lot of temporary treatments that can help briefly alleviate that pain, such as cortisol and steroid shots. There's tramadol, there's morphine, which, believe it or not, is still used, and those nerve blockers. However, there is one experimental and controversial, but otherwise, in the case of CRPS, an incredibly effective treatment that I'll be covering today, and that is ketamine. So, ketamine treatment efficacy. Out of a Mayo Clinic study that was conducted, 13 out of 14 of the case studies determined success rates upon alleviating CRPS-related pains for prolonged periods. 0.14 milligrams to 7 milligrams were administered to patients meeting CRPS criteria, which resulted in an overall pain relief. Ketamine will block the neurotransmitters affected by CRPS. They block neurotransmitters at the NMDA receptors, which stop pain. It also allows for brain to craft new neural pathways after damage inflicted by CRPS. I would also like to note, it isn't directly stated in this slide, but ketamine can also have those positive psychological effects, which, as we had previously mentioned, that heightened emotions can often spur more pain. Ketamine is a dissociant, so it can almost separate that sense of your body and your identity. You get that sense of pleasure, and you feel warm and nice, according to my mom, and she's found that for those infusions, it's been like a huge blanket lifted off of her chest with that pain. It has also been observed that it improves your pain threshold. Out of 114 CRPS patients observed, 101 patients experienced a strong clinical outcome. 6 had a weak outcome, and 7 had 0 effects. And this data was collected for a publication by the Clinical Journal of Pain. And as you can see, I did provide the graph that documents that data. So unfortunately, the experimental nature of ketamine treatments often result in it being unavailable or incredibly pricey for CRPS patients. Because of this, many become reliant on prescribed opioids, which is dangerous and can lead to a lot of addictive behaviors. Opioids are often prescribed because doctors tend to not know what CRPS it is due to the rarity and just the nature of the disease. So they will be prescribed things like Percocet and other things, which can lead to really dangerous areas. So I'm going to briefly cover this ketamine treatment. It is administered via an IV drip, and the person receiving it will be monitored by medical personnel. Patient will report feelings of disassociation, warmth, and pleasure. And after those, the infusion can span from a couple of hours over to several days. But once it is complete, that sense of pain relief can last over a couple of weeks, which is like a miracle to CRPS patients, especially since the pain is, as I've noted, chronic and agonizing. So in conclusion, CRPS is a deeply complex, mysterious, and rare syndrome with little research. Pain is reported as agonizing, chronic, and unbearable. Symptoms are extremely painful and distinct. Diagnosis is achieved through a variety of observational means. However, there is no known treatment. Ketamine therapy has been proven effective in a lot of cases. And as you can see, that's a young me taking care of my mom after she was diagnosed in 2016. So here are all my references, and I'd like to thank you for your time.